Today we're going to talk about the different type of ADHD testing that is out there. This is a topic that isn't talked about too much, and there's a lot of misconceptions and misinformation that I hope I can clear up with this video. This video is going to be in simplified terms so that anyone can understand it. I'm not going to use too much clinical jargon. I want people to walk away from this video feeling informed and educated about the different types of ADHD testing that's available and testing that would be most helpful for them. If you have not been here before, my name is Matt Ryan. I own and operate Progress Therapy, located in New York City, also licensed in New Jersey. We are a group practice that specializes in ADHD, ADHD testing, DBT therapy, and other things as well. You can read more about our practice at the link down below. We also offer free 15-minute phone consultations for people who are interested. Again, the link for that is down below in the description. But without further ado, let's get into today's video. So the first thing we need to talk about is why someone would actually want to be tested for ADHD. You may think this is self-explanatory. Now, a lot of people are self-diagnosing, but this is never sufficient. If we suspect we might have symptoms of ADHD or we might be dealing with ADHD, it's always helpful to get a proper evaluation. Getting a proper evaluation is going to do several things. For one, it's going to make sure that we're pointed in the proper direction and we can receive the treatment that is most effective for the issue that we're dealing with. So if we are actually dealing with ADHD, then we want to get treatment for that. However, the other thing that a proper evaluation does is it can rule out other issues. For example, there's been cases where people present with ADHD symptoms and they think they have it, and it turns out that it was a sleep problem. Right? There are countless examples of this, and a proper evaluation is going to make sure that we rule out other alternative explanations for the symptoms someone is experiencing. We don't want to miss anything. Now, the other question we have to ask is who can actually do ADHD testing? And I find that this is where most people are a bit confused and are misinformed. People typically think that only a psychologist or a PhD can test for and diagnose ADHD, and this is a misconception. There are a variety of mental health providers who are able to test for and diagnose ADHD. Just for example, LCSWs or licensed clinical social workers are qualified to test for and diagnose ADHD. Many people don't think this is the case. However, it is. What does need to be made clear is that an LCSW or any other master's level clinician is not able to do something like neuropsychological testing. This is done by a PhD who specializes in that kind of thing. So I do want to make it clear that although LCSWs and other people who are not psychologists can test and diagnose ADHD, they are not able to do everything. And some other people who are able to diagnose ADHD include nurse practitioners, doctors, and other professionals as well. And it's important to know that not every mental health professional is going to conduct the same type of test. There are going to be providers who do it better or more thorough than others. And that's what we're going to talk about next is what should ADHD testing look like and which one might be right for you. Now, one of the issues is that there's no standardized one and done test for ADHD. There are all sorts of ways people conduct testing for ADHD and come up with a diagnosis. Now, this causes a problem because every professional is going to have a different method. This is a problem for a few reasons. One, it leaves way too many options. And number two, it's going to create an issue for the client or the patient. Provider usually advertises ADHD testing and the client or patient doesn't really know exactly what that means or how is ADHD testing at Clinic A different than ADHD testing at Clinic B? Why is it this much at Clinic A and this much at Clinic B? And we're going to talk a little bit about that in today's video. It is our thought at Progress Therapy that testing for ADHD it should be thorough and comprehensive. It should never be done in 15 minutes in one visit. That should never be the case. You should never walk into an office, see a professional for 15 or 20 minutes, get a diagnosis of ADHD, and then walk out. This is not okay. It's not acceptable. The testing and diagnosing should be comprehensive. Okay, that is for sure. We'll talk a bit about what comprehensive means in just a minute. But that is one thing we do at Progress Therapy. We make sure all our testing and diagnosing is comprehensive. It's never one and done. You don't just come in for 15 minutes and walk out with a diagnosis. We run a whole bunch of different scales, tools, and measures and interviews to make sure that we are doing testing that's accurate and thorough. Number two, we also want to make sure we're not overly testing. So some people hear the term neuropsychological testing. This is an extremely comprehensive form of testing that people can do. It is usually conducted by a psychologist. It is super expensive and often difficult to get in for that kind of test, which creates many barriers for people. Now, the thing is, not everyone requires a neuropsych test, right? It's not for everyone, although it's extremely comprehensive. So at Progress, we also don't want to oversell what people need. We don't want people having to go through excessive testing if it's not necessary. So at our practice, we try to find that sweet spot in the middle, comprehensive and thorough without being excessive and costly in an unnecessary way. Next, we have to answer, what does an ADHD test actually involve? Now, again, there's no one cookie cutter approach to this, and every provider is going to have a different method. But just to put it simply, a thorough ADHD assessment should involve a combination of methods. So it should involve scales, tools, screeners, self-report scales, interviews. In some cases, it should involve talking with family members and giving them some self-report tools. There should be a diagnostic interview. So it should be a combination of all these types of things. And all these types of things combined together usually takes several hours to conclude. And in our practice, we even strongly recommend that a client goes to a primary care doctor to rule out any medical issues that may be going on, make the evaluation that much more comprehensive. Now, for the sake of this video, we're going to break down testing into 3 different categories. I'm going to call the first one the most basic category. I'm going to call the second one comprehensive testing, or a medium category. And we'll call the third one neuropsychological testing, or the extremely comprehensive category. Now, the basic testing, the most minimal kind of testing, is what we don't ever recommend. This is where you might walk in to see your primary care doctor, or you have a one-time consultation with a psychiatrist. They ask you a few questions. It takes a couple minutes. They give you a diagnosis, and you walk out with a prescription and or just a diagnosis only after meeting someone for 15 minutes. This is a no-no. Now, what might be happening in those instances is that the doctor or provider is administering what's known as the ASRS, or the Adult ADHD Self-Report Scale. Now, this is a very simple self-reporting screener tool that is clinically validated and shown to be a good predictor of ADHD. However, it should only be used as the entryway to more extensive and comprehensive testing. It should not be used as the one and only diagnostic tool. However, a lot of providers use it that way. They will simply administer the ASRS. It takes like 5 to 10 minutes, and then they'll slap a diagnosis on. Now again, the ASRS is a good tool, but it should only be the entryway into more comprehensive testing. In our practice at Progress, we begin with the ASRS to make sure that testing is even needed, right? So it's a great tool for that purpose. The next category is going to be comprehensive testing. This falls right in between super basic, which we don't recommend, and neuropsychological, which might be too comprehensive for some people. And comprehensive testing is where Progress Therapy falls. This is going to be testing that involves a series of scales, tools, self-reports. We conduct a diagnostic interview, which takes several hours. In some cases, we provide questionnaires to family members so that they can fill it out, which is an important component of diagnosing ADHD. We will also give screeners and tools for executive function impairment. To put it simply, we are doing a multifactorial approach, and this takes several hours to conduct, score, and evaluate. Right? And so this is obviously going to be far more comprehensive than a 5 to 10 minute screener. It's going to be far more involved, far more comprehensive. It's going to be able to rule out other issues as well and give us a lot of confidence in making a diagnosis or not of ADHD. And by performing this kind of comprehensive evaluation, we're able to diagnose with confidence and as well as supply clients with letters, forms, and reports that are often needed for workplace or school accommodations. And then finally, we have what's called neuropsychological testing. This is a term that a lot of people have heard about, but they're not exactly sure what it is. Now, this is extremely comprehensive testing. Primary care doctors will often refer people to neuropsych tests for things like dementia, memory issues, these kinds of things. So not everyone requires this kind of neuropsych testing. It is super costly and not always recommended. Now, this is partly one of the reasons why we ask people to go to the PCP, is because a medical doctor is going to be able to tell you whether or not there are other issues going on that require a neuropsych test. A lot of clients, though, this is not the case. They simply require the comprehensive testing, and then we go from there. And this is just a simplified explanation of the different types of ADHD testing available: basic, comprehensive, neuropsych, super comprehensive. And at Progress Therapy, we're falling into the comprehensive category, which we find is really helpful for many clients. It meets the needs of comprehensive testing while also not being too excessive and unattainable and too costly. If you want to learn more about Progress Therapy, you can go to our website, progresstherapy.com. It's linked down below. If you're interested in working with us, you can set up a free 15-minute phone consultation by calling us, emailing us, or scheduling at the link down below. Anyway, I hope this video was helpful for you. I hope you learned something. And until next time, I look forward to seeing you soon.